Here at the University of Minnesota Extension Children, Youth, and Family Consortium, we create case studies to help faculty and trainers promote interdisciplinary education about child development and mental health. Case study learning brings real-life situations into a classroom or training setting by introducing characters with history, relationships, and real-life problems. Case study learning promotes analytic reasoning by requiring problem-solving based on the information presented in the developing story. Case study learning engages students differently than a standard lecture by presenting situations within a story, with characters, relationships, histories, and real-life problems. Rather than just applying textbook information to a situation, we start with a situation and consider what we know from textbooks, journal articles, and other stories. Case study learning promotes interdisciplinary study because it incorporates research, theories, and perspectives of many disciplines. These cases were written with input from professionals in many disciplines because children and families encounter all of these professions when seeking help. And finally, case study learning promotes engaged classroom discussion and active inquiry based on users' experiences with the case curriculum. Our two case study curricula both present an ecological, developmental, and interdisciplinary approach to mental health and well-being. The Brianna and Tanya case curriculum reflects themes of infant and early childhood mental health, educational disparities, trauma and toxic stress, financial insecurity, and intergenerational issues. The About Stephen case curriculum addresses themes of adolescent depression, school, mental health, rural mental health services, and social-emotional development.
I use it in positive behavior guidance, which is for early childhood studies students, and the urban education birth to grade 3 licensure students. They all take the behavior guidance class, and then we have also used it with social work and nurse practitioner classes, and then we join together at the end of the case study so that our students are getting that interprofessional experience. We talk about infant and early childhood mental health, the impact of stress, the impact of adverse childhood experiences, and so it kind of is a really nice way for students to get a look at how that might look or be manifested in a family, and how the generational impact can affect young children. It's so interesting because we do the case in chunks. So we do chapters 1 through 6 and then 7 through 12. So we do it in chunks, and then they're always so curious to know, Anthony, come back. How do they? So they kind of have a little bit of ownership and curiosity and want the best outcome for for Brianna and Tanya.
Students using the case will click through pages to learn about different aspects of the case and answer questions that test their knowledge on the presented material. Different activities and modules will strengthen their learning and understanding of the case, and critical learning components help them to review the objectives. Navigating the cases is user-friendly with a navigation bar that lets the students pick up right where they left off. Learn more about these case studies and how to use them in your course at z.umn.edu/CYFC cases.